the Bronx, New York. I want to introduce the key persons here for the presentation this evening. We have Wayne Maurice, our technical person, and also he's like the operations manager for the Jamunogizer product in Kingston, Jamaica. And of course, we have with us Dr. Robert Robinson. He's a medical doctor. We kind of gave more details about him last, and he's a research scientist, one who received the gift to develop this product. In Jamaica, it's called the Immunogizer. For export purposes, we had to rebrand it. So in the United States, it's called the Jamunogizer. So without any further delay, well, one more thing. Last week, the first week, we're going to be going for about 4 weeks here. So last week, we did an introduction to the sabbatical diet. That was the main focus. This week, week 2, we'll be talking about the role of probiotic supplementation, the sabbatical diet, which was developed by Dr. Robinson, and the Jamunogizer. So I'm sure you're going to have a lot of questions. We're going to let him present for the first 20 to 30 minutes, and then the final 30 minutes will be open to answer your questions. Again, I want to say to all of you who have joined us tonight, welcome. Wayne, would you like to say anything before we turn it over to Doc?
No, I just want to say that, we're very glad to have everyone here who's gathered. I mean, there are persons from Jamaica, from the Caribbean, from London, from the US, and it's so good to have this session. And so let us just sit back and listen to what Dr. Robinson has to say to us. Thank you.
He's muted. You have to unmute him, Wayne.
Yes, I'm trying to find it here. 1 second. Okay, you can unmute yourself, Doc.
Okay, thanks very much. Good afternoon, everyone, and welcome for all who are here today. And Gladstone, thanks for the introduction again. All right, today this is our second week, and I'm going to go straight into the PowerPoint, and then we'll have the discussion after. Right. There's some competition in the back there. All right, the name of the series is How to Improve Your Health Using Biblical Principles. And we looked at the sabbatical diet last week. We'll be looking at Jamunogizer and how the formulation is structured. Just to give a quick overview of the series. Week 1, as I said, we did a historical overview on the sabbatical diet. This week, we'll be looking at the role of prebiotic supplementation. Next week, we'll look at the role of desmutation catalysts. Now, the information that I'm giving you, the source of knowledge is from first biblical principles, which is Bible, getting from the Bible. Scientific findings, including experiments. Clinical observation, we run a clinic in Jamaica, and we have seen over 15,000 patients in the 30 years. And spiritual revelations, which has helped considerably in working out these principles. So quickly recapping what information we gave so far, what I think we point out, there's an obvious dilemma between what the biblical expectation is and reality. What I mean by that, when you read the Bible, you hear about how wonderful we are made, fearfully and wonderfully we are made. But when you look at the statistics of health, statistics are looking very poor. Most of us die by 70 to 80, even though our lifespan is 120. Overweight, diabetes, asthma, arthritis, all these are increasing in astronomical numbers. And the death rate of cancer is increasing. 1 in every 3 person in the US will get cancer in their lifetime. We concluded that the problem was food and water. And we discussed first the sabbatical diet, and we said that the key things in the sabbatical diet was outlined in Exodus 16, and it's based on a non-negotiable instruction that God gave Israelites, which was to have a 6 heavy breakfast and 1 fast per week. And we showed them that the main effect of the sabbatical diet was a slow aging process. Now, despite following the sabbatical diet since 1980, in 1999, I developed a severe condition of rheumatoid arthritis. When I said severe, at one point, at least in the latter part, I was taking somewhere in the region of 16 to 18 different medication in order to control the pain. The plan was at the time to seek further treatment overseas, but one night while coming from church, I heard a voice in the back of my car saying to me that the problem was that I had too much yeast in my body. As a result, I developed a prebiotic mix, which is the early formulation of what later on became the Immunogizer and now Jamunogizer. And within a month, I was able to reverse all the symptoms that I was suffering from at that time. Now, obviously, I look in the Bible to see what the Bible has to say about prebiotic. And the probably most powerful prebiotic that exists is wine. And if you look at 1 Timothy 5, verse 23, it tells you about Paul is instructing Timothy that he must use a little wine for his stomach and for his frequent illness. And we're going to talk a little bit about wine and prebiotic as we go along. Now, in 2004 to 2015, we studied wine significantly, and we used the prebiotics that were in wine to develop the product to a certain level in 2015. And when we look at our patients, we were seeing improvement in all conditions, all clinical conditions at our wellness clinic. And we'll get some more details as we go along in the presentation. So the thing is, what do you understand by prebiotics? How should we understand prebiotics? To understand prebiotics, we have to first understand about the gut and what we call the gut microbiome and so on. Now, the human body is in a symbiotic relationship or a mutualism relationship with bacteria that lives in your intestine. Very much similar. We talk about these relationships between one species and another species. The classic example is the cow and the birds. As you know, the birds remove the ticks and they get food, and the cow in return, health is improved. Now, in a similar way, we have a symbiotic relationship with bacteria that lives in our intestine. Roughly, the bacteria that live in your intestine adds up to about 100 trillion microbial cells, while your human body only has about 10 trillion human cells. So in fact, there are 10 times more bacteria cells in your body than cells of your own cells. Now, when you examine how these bacteria are arranged in the intestine, in the upper intestine, you have about 100 to 1,000 bacteria per mil of intestinal content. But as you travel down the intestine, going into the small intestines, it goes up to 1 billion, and then by the time you reach the large intestine, where the majority resides, you are in the trillions. Now, a lot of studies have been done to show this association between gut bacteria and human diseases, and these studies include what we call intervention studies and population studies. When I say intervention studies, I mean they give the person prebiotic and see the results, and that has been shown to be very beneficial. Prebiotics is defined in the medical literature as a non-digestible food ingredient that promotes the growth of beneficial microorganisms in the intestine. You probably heard the term probiotics also. Probiotics is different from prebiotics. Prebiotics talks about things that in the environment that helps to promote the growth, while probiotic is the organism themselves, like a live bacteria or yeast. One of these things we have been doing in medicine is fecal transplant, and they have removed feces from one person and transplanted into another person, and we found improvement in health. For instance, one person might be obese and they remove slim, and they remove the feces transplanted using colonoscopes, and as a result of that, the other person loses weight because of the change in the bacterial flora. And there are also population studies, and I will look at one, a very interesting one from where they compare the bacterial flora of Burkina Faso in Africa versus the flora in Europe, and we get to that in a little while. So a number of diseases has been shown to be beneficial. The intestinal bacteria can be beneficial too, and this includes HIV infections, diabetes, cancer, liver disease, rheumatoid disease, chronic heart disease, kidney disease, obesity, bad sleep, etc. Now, whenever you examine the microbiome, they have found that there are three things that are important. The type of bacteria is extremely important, and you probably hear people talk about good bacteria and bad bacteria. And the good bacteria are what we call the Firmicutes, the Bacteroides, and the Actinobacter. A good example of a bad bacteria is the Proteobacter, and you all probably heard of E. coli and E. coli infections and what E. coli can do. But the type of bacteria is not the only important factor. Another important factor is the ratio of the bacteria. For instance, Bacteroides must dominate in your intestine, right? So we need to look at the ratio between, say, the Bacteroides and the Firmicutes and such. Each, for instance, should not dominate, and it should be minimal. The third thing that we look at is the activity level of the bacteria. How much metabolic activity is going on in the bacteria in the intestine. So I'm going to turn to a study done by Carlotta, and they were comparing the gut microbiota in children in Burkina Faso. Burkina Faso is in West Africa. Compare it with children from Milan in Italy. Now, they first compared the stool samples before weaning. And what they found was that the bacteria colony in Milan and the bacteria colony in Africa or in Burkina Faso was identical. There was no difference. Now, once the children were weaned and they continued to study the bacteria over the next 6 years, they found that there was a marked difference between Milan and Burkina. Now, this is a picture of life in the rural villages in Burkina. As you can see, they depend a lot on subsistence farming. They preserve their food by drying it. As you see, this lady is spreading out some seeds on a platform for it to be dried. Now, Milan is quite different. It's an industrialized country, an industrialized town, and all these features of industrialization is seen in that city. Now, when you compare the disease in Europe with the disease in Burkina Faso, some interesting things are observed. For instance, asthma is a very common disease in the first world. It's very common in industrialized cities. Asthma is very rare in Burkina Faso. When you look at what they call autoimmune disease, like the rheumatoid arthritis, lupus, and that set of disease, they are very common again in industrialized countries. They are very rare in Burkina Faso. Ulcerative colitis is another example, and cancers. Breast cancer is very unusual in Burkina Faso up to 2010. Things have been changing there because they are becoming more industrialized, but at the time when the study was done by Carlotta in 2010, breast cancer was rarely seen in that community. All right, the first thing we want to look at is what they found in the stool when they examined the stool of the Burkina children versus the stool of the Italian children. Now look at the left side of the picture. You see two circles, and the top circle represents Burkina and the bottom circle represents Milan. Now you notice that there's a green band, and the green band occupies about 73% of the type of bacteria they found in Burkina Faso. And the green represent Bacteroides. Remember I said earlier that Bacteroides is supposed to dominate. So 73% of the stool in Burkina were dominated by Bacteroides. But if you look at the other circle below, you notice on the green band, only 23 plus 4, that is 27% of the bacteria in Milan were Bacteroides. The species of Bacteroides in Burkina also was different from the species that they saw in Milan, because the heavy green and light green represent the species. As you see, in Milan, it was blue and a light blue. So there were different species, and the Bacteroides did not dominate in Milan. On the other hand, you look at the firmicutes. The firmicutes is represented by the red band. In Burkina, only 12% of the bacteria were firmicutes, while in Milan, it's 12 plus 25 plus 9 plus 5. A significant amount were firmicutes. The other group is actinobacters, 15% in Burkina and 22% in Milan. So you can see the ratios were quite different, and even the subspecies were different. We also look at the activity level. Remember I mentioned the activity level is very important. Now on the left, you're seeing a graph showing the activity level of the bacteria in Burkina, which is in black, and in gray is the activity level in Milan. Now what they do, they measure how much what we call short chain fatty acid. These are the acids that the bacteria produce, and we can measure how much acid is in a gram of stool. Now in Burkina, the total short chain fatty acid added up to about 85 micromole per gram, while in Milan, it only added up to about 30 micromoles per gram. So the bacteria in Burkina is approximately three times more active than the bacteria that they saw in Milan. We did look at the different acids, like acetic acid, propionic acid, and so on. Again, you can see the Burkina levels are much higher than the Milan levels. They also look at bad bacteria. Remember we mentioned that some bacteria are bad, especially proteobacters. We see E. coli on the right. That's a graph on the right. What we are seeing there is that the black represents Burkina, while the gray now represents Milan. In Burkina stool, only about 10. There was the numbers they found for the bad bacteria, while in the case of Milan, it was about 40. So bad bacteria was much more common in Milan than it was in Burkina. All right, so what dietary factors explain the difference in Burkina Faso and Europe gut bacteria? And you just have to look at the diet and you'll begin to see the difference between the two. Processing of food, very important, especially white flour. White flour is produced by bleaching of the whole wheat flour. When you bleach the whole wheat flour, you produce a compound called gliadin, and gliadin is a low molecular weight antibiotic product, and it suppresses the good bacteria in your bowel. Apart from processed food, we use a lot of chemicals, obviously, which Burkina is not doing, because I said they are using subsistence farming and drying their product, their food product, and we use a lot of pesticides and antibiotics. Preservatives is a big culprit. We use a lot of chemical preservatives in industrialized countries, while again in Burkina they're not using that. Antibiotic use for treating infection, and even the chlorination of water. Now, chlorine is an antibacterial product, and therefore when you drink your water, you're also influencing the colony of bacteria that resides in your intestine. So these substances have an antibacterial effect on the intestinal bacteria. Okay, so we said earlier on what is prebiotic, and prebiotic is often described as undigestible product, but I think that is not a proper definition. A better definition would be substances that create an environmental condition conducive to specific microbial growth and significantly affect all areas of the digestive tract. So if you have a prebiotic in the large intestine or small intestine, it is going to influence which bacteria grow. We mentioned earlier that probiotics are living microorganisms, and they are very effective in the small intestine, but not very effective in the large intestine, because it's very unlikely you can get the density of bacteria in a probiotic to match what is in the large intestine. Remember we said the large intestine has trillions of bacteria per mil. It's very difficult to produce a probiotic beyond a billion per mil. So it has an effect in the small intestine, but definitely not in the large intestine. And we use the term sometimes symbiotic, which really represents a product that is both probiotic and prebiotic. And if you wine is an example of that. Active wine, I mean wine that is still fermenting, but it would have the organisms in it, plus the organism would have produced prebiotics. And yogurt is another example of that. Now, how prebiotics correct this problem? And I'm going to use a picture here, a glass of milk, and notice that the milk is black. This is just in order to make the presentation more clear. Now, if you had a glass of milk and you put it on your counter and you didn't add any acid to it, tomorrow morning you'll have spoiled milk, and you'll have to discard that milk and throw it down the sink because it will taste very sour and obviously not fit for consumption. But if you take that same milk and add a little lactic acid to it, tomorrow you'll get yogurt, and yogurt, as you know, is sold in the supermarkets and it has high price. So depending on what you do, you can get spoiled milk or yogurt. And what makes it different is prebiotic. The lactic acid is a prebiotic, and therefore it determines what bacteria is going to grow in a particular environment. Okay, now wine is the mother of all prebiotics. There's no other compound on earth that has more prebiotics than wine. The prebiotics in wine comes first from the fruit. Prebiotics are present in all fruits and so on. So obviously wine is made from fruits, so they're going to get prebiotics from the fruit. But the fermentation process of that goes on in the production of wine also generates a lot of prebiotics. Well, if you look at the wine that was produced 2,000 years ago and compare it with wine that we are producing now, the prebiotic levels of wine 2,000 years had significantly more. And the reason for that is that they were used in mixed culture, while what we are using now is selective culture. What I mean by that? When they were producing wine 2,000, 3,000 years ago, what they would do, they put the wine in what they call a wine press. Then the persons would wash their feet and go into the wine press and crush the grapes with their feet. Now, what that does, it causes a number of yeast and bacteria from the foot to enter into the, what they call the fat or the must. And this would end up producing quite a lot of prebiotics. And the sugar would be converted into a lot of prebiotics. Now, what we do today is that we use selective culture. Because we want the wine to have a high level of alcohol, usually 12 to 15%. We select the strain of yeast that will give us that product. As a result, now most of the sugar is now converted into alcohol rather than prebiotic. So the spectrum of the wine 2,000–3,000 years ago had far more prebiotic. The alcohol level was obviously lower. The alcohol level was probably like 4 to 5%, very much like our conventional beer as compared to the wines that we are producing today. And what are some of the prebiotics? The food acids again, food acids coming from the fruits. Special sugars are in the fruit. One particular one that is very important is called fructooligosaccharides. And then there are these esters and polyesters. This is a reaction now going on between the acids and the sugars, the acids and the alcohol, the acids and the amino acids, and they are producing a wide range of prebiotic products. Now, why is that important? Because you want prebiotic to work in the stomach, you want prebiotic to work in the small intestine, you want prebiotic to work in the large intestine. Now, because of these multiple compounds, some will release their product at different areas along the bowel, and as a result, you get a wide spectrum of prebiotics and the effect on the intestine. Okay, so the prebiotic formulation that we use in Immunogizer and Jamunogizer now are similar to what you find in the biblical wine. Now, what has our clinical experience been like? Now, as I said before, we operate a clinic in Kingston, and we study the effects of the product on these patients. Now, what we found that prebiotics, especially those that affect the colon, is central to the healing mechanism. We found basically every condition that we gave prebiotic to, there was some benefit in that person's medical status. Some areas responded more than others, and I'll briefly summarize some of the things that we found. We found a high response rate in certain diseases like rheumatoid arthritis, which I told you I suffered from, lupus, cancers, menstrual disorder, fibroid, asthma, HIV, and migraine. We found a lot of response there. While conditions like sinusitis and hypertension was more moderate, we saw improvement in hypertension. The person's blood pressure wouldn't get worse, but it brought it down to a point and stabilized at a lower level. And then there were some conditions we didn't see a lot of improvement, just a small amount of improvement, which is things like Alzheimer's and multiple sclerosis. Sorry, oops. Okay, we did a study, a small study at Hope Institute. Hope Institute is a cancer hospice in Jamaica, and that is where they send many of our terminal patients go and have their last days, and they're looked after by a staff there. Now, we offer the staff boxes of immunogizer and ask them to give it to any patient who was willing to use it. Now, what we found was that persons who had a good food intake and had not removed their appendix, we had dramatic response in those persons. I mean, there's one patient who was actually weighed about 30 to 40 pounds. After about 6 months, she was up to 150 pounds and was able to leave the institution. That is how dramatic the results was. Persons whose intake was poor, though, didn't do as well, but person who did not have appendix did very badly, and we realized that there's some connection between the appendix and the immune system from that study. We also did a study at University Hospital and Asthma. We looked at 12 patients. 6 of them we put on the prebiotic, the immunogizer prebiotic. 6 were not. Both groups were on the conventional treatment, and the patients who were on the immunogizer did extremely well. These were patients who were very severe asthma. These were patients, again, who were admitted in ICU. So you're looking at the worst of the worst. And the 6 persons who were on the immunogizer did extremely well, and many of them were now considered as mild to moderate, as against those who did not get the immunogizer, was still considered as severe after the treatment period. And we didn't see any side effect with the use of the product. I think I may have left. Okay, sorry. So these were some of our clinical experience we had. So the question is, how does prebiotic work? And what we were able to come up with is a schematic of how we think it works. Now let us say, unfortunately, you have a brain cancer. And in the picture, you see that blue object representing a brain cancer. The brain and the red dot representing the cancer. Now, your white cell can be divided into 2 broad categories. We have what we call the helper cells and the killer cells. Now, helper cells is what we call the informer cells. Now, when it comes to the body, informer is a good thing. So the informer cells will go to the site where the cancer is and take an extract. And take that extract and carry it to the appendix. So what you see, those yellow objects carrying that red dot is a helper cell transporting the extract from the cancer to the appendix, where we see those stars, and it's depositing that extract in the appendix. Now, the bacteria, once you introduce a biological compound in a bacterial environment, the bacteria is going to produce agents that counteract that product. What we call that plasmids. That's what these are little DNA molecules they produce, and they share it among themselves so that they are able to destroy this thing that is invading their space. This is one of the reasons why when you get infection in a hospital, or what you call hospital-acquired infection, it's usually very severe, because those bacteria are quite familiar with the antibiotics there, and they make these plasmids and share it among the bacteria in the hospital environment. So when you get a pneumonia in the hospital, more likely none of the antibiotics will work. They have to use special antibiotics to be able to reverse the situation. So they're bypassing these extract into the appendix. The bacteria produces the plasmid, which is represented by that little purple band. Now, the purple band, the appendix is designed with a lot of white cells surrounding the structure itself, right? We call it the Peyer's patches. So this is this massive amount of white cell that surrounds around the appendix, and especially killer white cells. So these killer white cells will now be able to extract from the appendix these plasmid, and by extracting the plasmid, they now multiply that information across the board to other killer cells, and they use that information now to destroy the cancer. So this is a theory we have as to how it works, and so on. So back to our biblical expectation, as we said, the reason why we are not seeing the kind of health that is described in the Bible is because we have destroyed our food and water. Next week, we'll be looking...
No, just a second. Some persons mentioned that they're not seeing the screen.
Okay.
I'm not sure.
Not see the screen?
Yes.
Okay. I'm sure you are seeing it?
I'm seeing the screen.
I don't know. Let me... wow.
Because we're not seeing the screen from Jamaica.
Okay. We'll have to try and show it again because I'm actually at the end of the script and the problem thing. Let me resume share again and see what happens. I see it now. You wait?
I'm seeing it. Let me find out. Is everybody seeing the screen now?
Yes, it's working now.
Okay.
I'm seeing it.
Yes, I'm seeing it. It was a stuck on one thing.
We're seeing
let me try.
what you were showing, with the about the this cancer cells, we were not seeing that.
Oh, is that last one? All right, let me try and go back to that one.
Some people don't see screen, but me I see it. Yeah. One, two, three, small. Yeah.
All right. So I want to pick everybody again now and undo it.
All right, let's see. Everybody seeing this screen?
Yes.
Yes, we're seeing it now.
Okay.
All right. Okay, I want to mute everybody else and then unmute now. 1 second.
All right, I'm going to try and go over this. That's okay? Unmute?
Yes.
Okay, everybody seeing the screen. All right, what we're showing here is a diagram trying to explain how we think the immune system works with the bacteria that resides in the intestine. Now, we have a number of structures there. The light blue structure is a brain, and it has a red sphere in it, which represents the cancer. The yellow objects represent white blood cells, and these are what we call the helper white blood cells. These are the informer cells. They don't attack the cancer. What they do is extract information from the cancer. So they're extracting this information. As you see, they have been traveling down to the appendix, which is represented by that cone with the blue stars in it. All right, and the red dot that you see in the white structures represent the extract that they are taking to the appendix, and they deposit it in the appendix. Now, because the deposit is a biological agent, usually is what we call antigen, it triggers off these bacteria to start to produce a product that will destroy this invader. All right, and what they do, they go into their genes and find molecular arrangements that can destroy this object. We call it, and what they produce as a result of it, we call it plasmids. For short, you could just say immune enhancers. So the second picture, oh no, it's not changing. The second picture here is showing you now. Notice you have the red dot in the appendix. The appendix is that cone shape with the blue stars, and it produces a purple band. You see the purple band at the bottom there. That purple band represents what we call the plasmid. So the plasmid is a DNA molecule, a small DNA molecule that tells the bacteria how to destroy this red dot, right? Now the bacteria is sharing it among themselves, and that is giving them the ability to destroy it. But the way how the appendix is designed, it's a very thin structure, and it is surrounded by a host of white cells, and primarily killer white cells. So what these killer white cells is doing is waiting to see how the bacteria respond to the extract. Once they figure out how they respond and they get access to the plasmid, they now will incorporate the plasmid into their structure and use the information in plasmid to know how to kill the cancer. So once they do that, they are now able to multiply that information and then attack the cancer and remove it. And everybody seeing it there? No problem there, Wayne?
No, that's good. That's good.
Okay, so I was ending and saying that the biblical expectation is correct. What has happened to us is that we have lost the ability to, our body has lost the ability to do many of these things because of how we have altered our food and our water. In this case, our food, we have used too much antibacterial products in our food, and the result is that this wonderful system of the interaction between the bacteria and the white cell, we have lost that, and as a result, we are overwhelmed by a number of diseases. Next week, we're going to look at how we have altered water, and another system has now been broken down as a result of that. Okay. Louise, turn back to you.
Okay. At this time, we're going to take questions, and it's kind of difficult to control 50-odd persons in terms of taking the questions. So I'm going to ask persons to just enter the questions in the chat area, and then Dr. Robinson would answer the questions based on what is posted.
Okay. So go down to the we could just read the questions as they come.
Yes, yes. Everyone is able to ask. Okay. Okay, the first question is, what diet could you recommend for my son who has Down syndrome?
Down syndrome.
Yeah.
All right. We mentioned last week the sabbatical diet, which has just made a summary of that today. Let me go back to sharing, right? So I just bring my sharing is still on, right?
Yeah.
Sharing is still on with, right?
Yes, yes.
Okay, let me just quickly go to the summary, which is the diet we recommend for everyone. This is sabbatical diet. This diet is explained, is in Exodus chapter 16. And it's a diet, what we call a restoration diet. All right? If you read the story carefully in Exodus 16, it tells you that you must eat a heavy meal in the morning. And on the seventh day, which was the Sabbath in that case, they would fast on that day. We went through in detail in that last week. We would probably have a recording that we probably could share with you on some of the details we discussed there.
Okay, thank you, Doc. Okay, a question from Marlene. And the question is, if someone has breast cancer, what would you recommend for that person?
All right. The immunogizer stem cell is one we normally use for breast cancer. It has the prebiotics we just discussed that are found in the wine, the original wine that was in 2,000 years ago. That those prebiotics is going to activate your bacterial colony, which will make them able to inform your white cells how to destroy the cancer. And what is very beautiful about this system is that cancer is a dynamic disease. And you probably heard about people getting chemo and getting very good results initially, and then the cancer recurred a year or two later, and the chemo has no effect because chemo is not dynamic. What we're looking at is a dynamic system. So if the cancer mutates and changes its color or changes the way it attacks, the body can repeat this process as many times as necessary to ensure that the white cells are equipped to kill the cancer. So once you're on it, your white cell will in a short time learn how to kill the cancer and destroy it in the process.
Okay, thank you, Doc. There's a question from Simone, and she says that you have not mentioned the effects of prebiotics on diabetes. Can you address this issue, please?
Okay. Prebiotic, the problem with diabetes is a little different from the problem with cancer. In the case of diabetes, the problem is not so much that the immune system is why the cancer is maintaining, why the diabetes is having this chronic nature, but rather due to a problem of free radicals. Now, next week, we'll be dealing with free radicals and how the body is designed to remove free radicals. And the reason why the body is not removing the free radical has a lot to do with how we alter water. So diabetes doesn't really come in a lot here. Obviously, diabetics are prone to infection. So, and therefore, having a good immune system will help to reduce the infection rate or result in the infection healing at a faster rate. But to reverse diabetes, the problem is not so much an immune system problem, but what we call a desmutation problem, which is what we're going to deal with next week.
Okay, Doc. There's a question from Suzette. She says, what diet can you tell me for my dad in Jamaica? Suzette, I'm not sure what condition does your dad have? Okay, he has skin cancer, melanoma cancer.
Okay. Well, what we're talking about is how the body is designed to remove cancer. The body has a system built in. All of us were born with that system. The system is not working because we have altered the food. And the only way to get the system to work, you have to have a healthy bacterial colony. And your bacterial colony is not healthy because, as I pointed out, the preservatives in the food, the processing of the food, the high use of antibiotics in production of food, and also for disease control has altered this the bacterial colony. So you no longer have a bacterial colony like what we see in Burkina Faso. What you now have is a bacterial colony like what we see in Milan. That bacterial colony is useless. It doesn't have enough bacteria. It doesn't have the activity level of the bacteria are too low for your body to produce the necessary things to destroy the cancer. But once you get the activity level back up, which is what the prebiotic does, the prebiotic will protect the good bacteria and help them to grow, to flourish. The body will now has the ability once more to destroy the cancer. So we all are built with a natural system, but the system is not working because of the alteration of it.
Okay. All right, there's a question from C. Orville McLeish. He's on the fat reducer for 2 months and putting on weight. Am I missing something? I do the large meal in the morning.
And does you fast?
Yes, the fast. Well, no, didn't mention if you fast.
Okay, well, that's the first thing I would want to find out if he's doing the fast. The fast is very important because your fat is essentially part of your healing system, and if healing is not going on, the body tends to retain fat. Fasting is very important for that healing system to be activated. So that is what we dealt with in the sabbatical diet last week.
Okay, so pretty much just need to include the sabbatical diet fast process into the diet. Okay. All right. Hi, good evening. How does the product help with spontaneous CFS leak? How does the product help with spontaneous CFS leak?
Okay. If you have a leak in the CSF, then obviously there's some damage to the lining. All right. Now, the diet will be very important because the diet, as we mentioned last week, is a restoration diet. Whenever you fast, the body removes damaged tissue. Whenever you eat heavy in the morning, the body puts in new tissue. So it's very important that the person is following the diet, because if they follow the diet, the body can do the repairs. Now, one of the things that goes against repairing is the presence of free radicals. Now, that is what we're going to deal with next week, how your body remove free radicals, because the stem cell is what does the repair. But the stem cell can't do the repair if there's a lot of free radicals in the area. So by going on the diet, fasting, eating heavy in the morning, 6 morning, that will allow the body to build the new parts. But also you need to have remove any free radicals around so the stem cell can do their job in completing the repair. But we have seen people with damages similar to CSF leaks and so on, also with CSF tumors that has done very well on the product.
Okay, thank you, Doc. All right, there's a question here from Andrew Williams, and he's asking, why were the 2 countries selected for the trial?
Well, I mean, they're looking at contrast. I think what Carlotta was looking at, he said, okay, there are disease going on in Europe that we are not seeing in some areas in Africa. And he thought that the reason for that is that there's a difference in the microbiome, the bacteria in the soil. So this is the reason why he said, let us study the two regions and see how the bacteria differ. And as you can see, they differ both in types, they differ in spectrum, and they differ in activity level.
Okay. Marlene is asking, which of the immunizer would you recommend? And I guess if it's to boost the immune system, then that would be the stem cell or the Jamunogizer.
That's correct.
There's a question from Simone. The immunizer is harsh on my stomach. Could I be allergic to some of the ingredients? I have gastro issues.
Well, I wouldn't think it's allergic to the product, but it's probably the product is a bit strong in view of the fact that your stomach is damaged. What I would recommend in that case is that you dilute the product in some juice or water so that it's less harsh on the stomach. Once your stomach starts to repair, you probably can use the product as recommended.
Okay, okay. All right, Andrew is asking, what does a full meal in the morning consist of?
Okay, what Jamaicans normally for dinner, we call that a full meal. But we looked at that last week, and we use a plate to explain. Half of your plate should be carbohydrates, a quarter of it fruits and vegetables, and the next quarter legumes or meat. If you go online to the sabbaticaldiet.com, there's a free book there that you can download, and depending on your height and your it tells you what a full meal would be for your height and so on. So a full meal would vary with persons, obviously. Persons who are larger body type would obviously have a larger meal than someone with a small and short body type, who's short and have a small body type. So if you go online, sabbaticaldiet.com, you'll see a free book there, free Sabbatical Diet Made Simple book. Download it and you'll see what a full meal would be for your height and your body type.
Okay. A question from Johanny. I have a form of arthritis at age 27. No test or x-ray has identified the type of arthritis. What do you recommend?
All right. At 27 is more likely you have the inflammatory arthritis, which include things like rheumatoid arthritis. Now, the blood test is not positive in all cases of rheumatoid arthritis, and that's why we talk about seronegative rheumatoid arthritis and seropositive rheumatoid arthritis. In other words, those which the blood doesn't show and those which the blood shows. That's basically what the test is showing. Irrespective of whether or not it is seronegative or seropositive, what is causing arthritis to a great extent is that your immune system is misreading your joint, and because of that, it's attacking your joints. Now, once the bacteria are stabilized, they are the ones who controls how the white cells activity. So they will obviously help the white cell to differentiate between self and foreign. And once that is done, the arthritis improves. So once you go on immunogize a stem cell and you stabilize the bacteria colony, the arthritis will improve within short order.
Okay. Okay, Suzette is asking, what kind of diet do you recommend?
All right. As we said, the sabbatical diet is what we recommend. That is on the screen there now, as outlined in Exodus 16. 6 every full breakfast and 1 fast. Only your breakfast is important. All other meals are less important than your breakfast. Again, if you go on sabbaticaldiet.com, You will get the free book we have there that will explain in more details. We did that last week, but if you get the book, you can, you can cover all the things we covered last week is in it.
Okay. Margaret, husband has stage 4 lung cancer, and she's asking, can the immunogizer help him?
Yes, we have actually a doctor from Grenada who contacted me in November who had stage 4 lung cancer, and it had spread to her brain. She has 2 lesions. She went to Florida, and they only were willing to offer her palliative treatment. That was last year, November. She had quite a bit of short of breath. She was very weak and so on. She actually had stopped working. She's now on the immunogizer and she's fine. She's back to work. She's living back to her normal life. She has repeated the CT scan in the brain and it is negative. She has repeated the CT scan in the lung and it only has minor, only small lesions are left and they are still disappearing, but not completely gone, but it's not affecting her quality of life right now. We expect them to disappear within another month or 2 when she's planning to go back to do another PET scan to review that. So irrespective of what cancer, irrespective of what stage it is, once you go on the product, the body will marshal itself to remove the cancer. The system is there. It just wants a healthy bacteria flora to work with.
Okay. All right. Fire tablets. Say I'm having a stinging pain all over my body. What can I take?
Okay. A stinging pain. Is it a joint pain or pain in the muscles?
Okay. They can provide some clarity
Mm-hmm.
in the meanwhile.
Okay.
So we can move on to that. All right. Oh yes. Orville has come back and said that yes, he does the fast. He had mentioned about putting on weight.
Okay. All right. Orville might be one of those patients we might need to, to discuss further. It's possible sometimes you can have hormonal problems that resist the diet, like say someone with a thyroid problem. We would not want to investigate to make sure there's no problem like that might not make the diet effective in Orville.
Okay. And Kanisha is asking, how often should we fast?
Oh, well, fasting from a physical point of view, we recommend fasting once a week, and it should last at least half day until 12 midday. It can go longer. If you go to 6 p.m., you get even better results, but at least half day. This is separate from spiritual fast. Now, you can do spiritual fast, and it doesn't interfere with the program, but the spiritual fast must be 24 hours or multiples of 24 hours. If it's a half day fast, again, and you eat in the evening, then it will have a negative effect. But if it's a full day fast, it will have a positive effect.
Okay. From Galaxy S10E, question is, what is good for eczema in a child and also fibroids?
Well, as we pointed out, for fibroids is one of the areas we found very good result with the immunogizer stem cell. We have a number of patients coming to the clinic who, with fibroids at different stages. And once they're on the sabbatical diet, they're taking immunogizer, the body will restructure the womb and remove the fibroids. The fibroids were placed there because there was too much free radicals in the womb. And next week again, we're going to talk about removal of free radicals. That's an important part of removing fibroids.
Yes. All right. So that's confirmed that her husband is taking this immunogizer stem cell.
Mm-hmm.
So I guess you just need to give her some assurance in terms of what to expect in terms of, like the time frame.
Okay. How long has he been taking it?
Okay. So we'll give her some time to respond.
Right. And how has he been responding since using it?
Okay. All right. In the meanwhile, we go to Princess. So my son has CKD. What product do I use?
Chronic kidney disease. That's what she mean by CKD. I'll assume it's chronic kidney disease.
Yeah, she'll have to clarify a little. All right, I give her some time to clarify that. But let's move on to Marlene. Which of the product did she use for the stage 4 cancer? That's a doctor.
Oh, it's immunogizer stem cell. If you go on the immunogizer website, immunogizer.com website, you'll see a video there with Dr. Joseph giving her history of what happened to her and how immunogizer has helped her.
Okay. Margaret says, I'm in the USA. How do I get to purchase it?
The Jamunogizer is now available in the US. You can get it through at jamunogizer.com, and once you go on the website there, the instruction will give you how to get it and so on.
Okay. Rayan, I have fibroids. I did surgery in 2014, and now it is back and very painful.
Yes, surgery doesn't prevent you from recurrence. All the surgery does is remove what fibroid is there, but the underlying problem is still there. As I said, the problem is a diet problem. Your body is not, the immune system is off, and also the free radicals, which we can talk about next week, are also a problem. So it's just a matter of time the fibroids will recur. But if you are on the immunogizer or the Jamunogizer, that will prevent the recurrence.
Okay. This is from John. My stomach is frequently bloated. I belch a lot and have not had a good sleep in a long time. I seem to dream a lot and wake up frequently. I've gained 40 pounds in 6 months. I have a history of GERD. I am on a probiotic capsule. Can immunogizer help?
Well, yes, bloating, a lot of bloating is due to bad bacteria. You get a lot of gas forming bacteria in the bowel, and these bacteria generate a lot of gas from the food, and that explains the bloating. Obviously, the bacteria colony is very unhealthy. As we pointed out, sleep is affected by a bacteria colony. Weight is affected by a bacteria. That's some of the things that we said that have been shown scientifically to be affected. Here's a list there. A number of them, which John just mentioned. The obesity is there. The bad sleep is one of the things that it's involved. So again, one of the problems with a lot of the prebiotics that commercial prebiotics is not. The spectrum is too small. What we do, as I said, we use the prebiotics that are present in wine, and you're looking at somewhere in the region of about 40 different prebiotics that are present in wine, and each one of them is designed for different bacteria that resides in your intestine. Most of the prebiotics that are sold on the commercial market have 1 or 2 prebiotics, and it's not sufficient to give you the kind of results you want.
Okay. All right. This is a note from Paulton. I just started using the stem cell for my son with Down syndrome. Can I use the brain maximizer as well, or should I wait until 3 or 4 months after?
You can combine the stem cell and the brain maximizer. What we normally recommend is you use the stem cell in the morning and in the evening, and then you take the brain maximizer at night. And both of them can be used concurrently. Okay.
All right, fire tablet is now confirming the stinging. It says the stinging is in my leg, back and fingers.
Okay, all right. We're probably looking at what we call a neuropathy, so a problem with his nerves. You would need to get some investigation, definitely. Some of the things you want to look at is like his B12 levels and other things that might affect nerves. Obviously, if you have a problem like a B12 deficiency, you would need to get B12, because immunogizer is not a B12 supplying product. But the immunogizer will help in the whole healing process. So once you correct whatever the deficiency is, I take the immunogizer along with that, you will reverse the symptoms quickly.
Okay. All right, the question is being asked that if the immunogizer stem cell is being taken, will the cancer spread to other parts of the body?
If you are taking immunogizer stem cell, the cancer will not be able to spread. And I have a perfect example of that recently. a patient of mine who had cervical cancer. And just before the COVID outbreak, she took the immunizer and traveled to the US, and she got stuck because of the COVID crisis. Now, she went to see the oncologist up there who did a PET scan and was extremely surprised that despite she having this lesion in the pelvis, there was no evidence of spread anywhere else in our body, and so on. The thing is, once you take an immunogizer, and we're going to talk a bit about the free radical next week, which is very important there when it comes to, again, cancer management, is that if a cancer cell comes out of the protective area where the primary is, it's very easy for the white cell to kill it. In fact, once you start taking the immunogizer, the cancer cells has to go into clusters to prevent the white cell from destroying them. When we talk about the free radicals next week, you'll see how the body will use the free radical and convert it into hydrogen peroxide and use that to poison itself. So in fact, your body makes its own chemotherapy, and we're going to look at that next week.
Okay. All right. Suzette is confirming that her dad, who has a cancer, has been taking the immunigizer from 1 to 2 months. So I guess she needs some kind of guidance in terms of how long should she take it before starting to experience some kind of benefits.
So he's not experienced any benefit yet?
She needs to confirm that.
Oh, okay.
Right.
Well, I would expect he start having benefits. I don't know what were the symptoms and signs and things he had before. What was his PSA level like? But I would expect he should be experiencing some benefit by now.
Okay. We can clarify.
Mm-hmm.
Right. And just a reminder, Doc, to speak to the child eczema if the stem cell or the Jamunogizer would assist.
Yes, they definitely would assist, yes. Mm-hmm. The Jamunogizer is the immunogizer stem cell. They are identical.
Yes. Yeah. Okay. I think that's kind of important.
Mm-hmm.
All right. Oh yes, the person is confirming that it's chronic kidney disease.
Oh, chronic kidney disease, right. We have had a number of patients with chronic kidney disease that who dialysis was recommended for. We have one patient, in fact, who went to the university hospital here for dialysis purpose, refused the dialysis and went on immunogizer and now have normal kidney function. That the video of that person can be seen at immunogizer.com, and she's there, Lily James. You look up for Lily James video and you'll see her testimony there. We have had a lot of patients at the clinic who have marginal kidney problem like stage 3, and we have reversed that as such. So most of our experiences with stage 2 and stage 3 renal failure, and we have reversed those patients. But we have had 1 or 2 persons who have had stage 4 and 5. In fact, there's a doctor in the US, well, a doctor's husband, so she's female, who has stage 5 kidney failure. They were planning dialysis on him, and he has moved from a 10% to a 20% the last time I spoke to her, and dialysis is not considered right now for him. So he actually reversed from a 5 to a 4 in about 3 months.
Okay, great. There's a very interesting question which I think could have come up. The question is that there are many different immunogizer products in Jamaica, mm-hmm. and there's just one Jamunogizer product in the US. What's
right.
The difference?
Yeah. That's a question for the people who are marketing the product in the States. But I would expect from a marketing point of view, they would probably start with one product and then expand.
Yes. Okay. All right. What can I take to gain weight?
Oh, well, just go on the sabbatical diet. I used to work at a clinic in Kingston and Mullines Road, where there was a doctor there who wanted to gain weight, and she was like 111 pounds, and she's about 6 feet tall, and she said she tried everything and couldn't gain weight. And I told her, just eat in the morning and fast one morning. And she was very skeptical about it. To her surprise, after 3 months, she was up to 130, 140 pounds. So she thought it's because she was eating the breakfast, so she stopped the fast, and her weight came right back down to about 115. Once you eat heavy 6 morning and fast one morning, you basically, the body will now begin to restructure you according to what you are supposed to be, right? It's a restoration diet. Every time you fast, your body assess itself and do the changes while you're eating on the breakfast days. So it's a diet, whether or not you're fat or you're slim. As I said, the main thing you'll notice is a slowing of the aging. Most people start the diet within 3 months. People will tell them that they are looking younger. Most of my patients who are in the 90s, if I ask people to assess the age, they will tell you that they're about 60. So we see a lot of restructuring of the body once you follow the diet and you're consistent with it.
Okay. There's some suggestion that the question regarding Jamunogizer product have been available in the US and several different immunogizer products in Jamaica.
Mm-hmm.
There needs to be some clarity in terms of what Jamunogizer really represents.
Jamunogizer is the same as Immunogizer stem cell, which is our main product. It's designed as an all-purpose product because it deals with a wide spectrum of the prebiotics. It also have a wide spectrum of the desmutation catalyst. That's what we're going to talk about next week. So it's like an all-purpose. It's very similar to the Immunogizer Premium. The only difference that Immunogizer Premium is made from honey, while the cane syrup is what is used to make the Immunogizer stem cell. But both of them are all-purpose, and they cover a wide spectrum of disease. The specialized products are like the Brain Max. Brain Max, we use a lot more amino acids in it, and that is to improve brain function, obviously. But it's highly specialized. Unlike the stem cell, which is more broad spectrum.
Okay, thanks, Doc. All right, Suzette mentions that her husband, who has been taking the immunogizer for between 1 and 2 months for the cancer, he's still having pain in his legs, and the doctor says it has spread to his groin. They want to do surgery, and his cancer is now at stage 3.
Stage 3.
Yes, and he's working from London. He's working from London.
Okay.
Well, 1 month, 1 to 2 months he has been on the product.
Okay. And it's prostate cancer, is it?
I think it was a lung cancer, I think. If my memory serves me correctly in the chat.
You mentioned about the legs, something about the legs. Eh?
Yes, but it says pain in his legs.
Pain in his legs.
That's spread to his groin.
Okay, the groin. Okay. Pain is in fact suggesting that the body is infiltrating the cancer, because normally cancer doesn't give you pain unless it's in bone or touching a nerve. Suggestion is that it's attacking the lesions there.
Right.
I would want to know how is he taking it and so on. He's taking things like that, but he should be getting a lot of reduction in the cancer mass by now.
Yeah.
What stage was he at initially when he started it?
Probably you could just reinforce exactly what how the product is to be taken, Doc.
Oh, okay, all right. The Jamunogizer, you need to take it for cancer patients. We normally recommend they take it at least 3 times a day. They take 1 teaspoon before breakfast, 1 teaspoon before dinner, and at night we recommend you take 1 teaspoon in a glass of water or juice. Again, the person has to be eating. Eating is very important. We saw in the study we did at Hope Institute that quantity of food is very important, because the body is going to use the food as its ammunition. And what Immunogizer is doing is correcting the problems in the food. It's what you have to eat. So once a person is eating and taking it, they should see, and like what I just mentioned, very good results in a short time.
Okay. All right. Galaxy S10 needs clarity in terms of what product should be taken for the child's eczema. And I think you did mention either the Immunogizer stem cell product or the Jamunogizer.
Yes, yes. Well, if it's in Jamaica, you could also use Immunogizer Light. It's designed for things like skin and upper respiratory problems with children. Immunogizer Light is actually designed for children.
Okay. Okay. All right. Okay, this person says, I have been on Immunogizer stem cell for almost 3 months, now for breast cancer. That has stayed to the liver. Should I be seeing any results as yet?
All right. Yes. The problem I need to do scans. I don't know if they have any symptoms or any mass on the surface that it's visible or it can be palpable. It's palpable. But I would expect to see changes, especially with the liver metastasis. Those lesions should be shrinking.
Okay. 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 Margaret is asking which one should she get for her husband.
That is the case.
I think that's the stem cell or the
Stem cell or
Jamunogizer. Yes. I have lipoma on my left shoulders and a small one under my arm. I'm very skinny. What would you recommend? My doctor wants to remove the lipoma.
Well, lipoma is a very simple problem to remove. I mean, doctor probably can't do that in his office. That would be the fastest way to get rid of it. I would recommend this surgery. What the Immunogizer will do is prevent new lipomas from forming.
Yes, yes, yes. Okay. So that looks like the end of the chat. Somebody says they're not hearing here. Kenisha Thompson, not hearing? You're still not hearing, Kenisha? Okay, not getting any response. All right, so that is the end of the chat, Doc.
Okay.
Anything else you wanna say before passing back to Pastor Johnson? Well, I'm seeing something from Andrea's iPod. It would be nice to know how many people joining in from the USA and from the WhatsApp. Yes, there are quite a few persons were invited from Jamaica and some from the USA. I'm not sure. It's kind of hard to get a mix with all the mics muted. And to mute all the mics can be a bit difficult. But you know, we have 55 persons at the highest level this evening, which is quite good. And I tend to believe that probably most of the persons have been from Jamaica. Okay, there's another question here. Immunogizer stem cell tastes sweet. Does this affect diabetes?
The short answer is no. We're going to look at next week why sugar, the benefits of sugar. Yeah. Sugar is the main driver for your body to remove free radicals, but you have to understand how it works with the particles that were normally present in water. So sugar is not a bad thing as it is made out to be, but it needs certain particles from water to get the beneficial effect from it, which obviously they have removed. So we suffer as a consequence of that.
Okay. All right, so that seems like the end of the chat session. I'm going to just pass back control to Pastor Johnson so that we can wrap things up. Not seen Pastor Johnson.
Okay, well, might have to just wrap up then.
Yeah. Okay, I don't know if I'm going to unmute everyone briefly, and just in case there are any last minute questions that anybody needs to ask.
Shut up.
How can we get the video that was done last week.
All right, we're gonna edit it and we're gonna send it out. We're gonna make it available to you.
Okay.
Yes, yes.
So every week you guys will be having a presentation?
Okay, we have one next week, Thursday, and also the following Thursday.
Okay, so because we want to follow it.
Yes, yes. So next week, Thursday, we're gonna have another one, same time.
Okay.
The same Zoom ID.
All right. It's gonna change because Zoom scrambles it, so it's gonna change. So we'll send it out. We'll send it out.
Okay. It was very interesting.
Yes, yes, yes. All right. Well, let me just
Thank you, Dr. Robinson. And thank you, Mr. Wayne Murray. Thank you so much. It was very informative.
Yes, great. Glad that you benefited.
I actually download the sabbatical that booklet.
Yes.
I'm reading through now.
Great. All right. So let me just thank everybody for participating. And you know, it was very good. It was very good to have you all. And you know, I trust that the questions have been answered. And we welcome you to come back next week, Thursday, at the same time, when we'll have another good session. Thanks again for coming, and all the best. Have a good evening. Thank you. Bye.